As a stress hormone and a neurotransmitter, norepinephrine plays a key role in many mental health disorders. It's vital to keep your norepinephrine levels balanced. As a stress hormone, it gets much less attention than the other main stress hormone, cortisol. Cortisol is well known for the damage that it causes. But norepinephrine is also a neurotransmitter, and it plays a role in depression, anxiety, ADHD, and other mental health conditions. Norepinephrine is a dual-purpose chemical messenger, and it acts as both a stress hormone and a neurotransmitter. It's sometimes called noradrenaline, especially in the UK, but in the US, norepinephrine is the preferred term. It's made in the brain, the central nervous system, and the adrenal glands. Its name literally means alongside the kidneys, referring to its synthesis in the adrenal glands. Norepinephrine, along with epinephrine, or adrenaline as it's known, triggers the fight and flight response in the face of danger or extreme stress. It helps you to think and to move fast in an emergency. It increases the heart rate and blood pressure, directs blood flow away from the skin and into the muscles, and it triggers the release of glucose into the bloodstream. Norepinephrine differs from cortisol in that it's created on an as-needed basis, and it dissipates quickly after the perceived danger or the stressful situation is over. Cortisol, on the other hand, lingers in the body where it accumulates, contributing to diseases like obesity, diabetes, heart disease, and cancer. No one, including experts, fully understand the biochemical causes of depression. It's known, however, that norepinephrine, serotonin, and dopamine, the neurotransmitters that belong to a group of compounds called monoamines, play a role in mood regulation. As with any neurotransmitter, your levels can be either too high or too low, but with none is this more critical than norepinephrine. The most popular theory of depression is it's caused by low serotonin levels. This is why most people take antidepressants, which are selective serotonin reuptake inhibitors, or SSRIs, which aim to increase the serotonin. Other theories posit depression is caused by brain inflammation, low BDNF, low dopamine, or low norepinephrine. The main symptoms of low norepinephrine-based depression are feelings of lethargy, brain fog, and a lack of zest for life. These symptoms are very similar to depression that's linked to low levels of dopamine. This makes sense since the two compounds are extremely similar in structure and function. Both are formed from the same amino acid precursors, tyrosine and phenylalanine, and both are essential for maintaining alertness, focus, and motivation. The biggest difference between dopamine and norepinephrine is that they are created in different areas of the brain and act on different receptors. Most prescription antidepressants work by increasing serotonin levels, with a few working on dopamine or norepinephrine, or a combination thereof. Wellbutrin blocks the reabsorption of dopamine, serotonin, and norepinephrine. Cymbalta is a serotonin and norepinephrine reuptake inhibitor, and this works by increasing both norepinephrine and serotonin. Tricyclics, some of the oldest antidepressants, work by increasing both serotonin and norepinephrine, while blocking the action of acetylcholine, the neurotransmitter of memory and learning. It's easy to see why prescribing antidepressants can get complicated, and why no one prescription antidepressant works for everyone. Another common disorder linked to norepinephrine is attention deficit hyperactive disorder, or ADHD. The conventional treatment for ADHD is a prescription stimulant like Ritalin or Adderall, possibly accompanied by behavioral therapy. Most ADHD medicine is based on the assumption that those with attention disorders are deficient in dopamine or norepinephrine. When you can't focus or sit still, taking a stimulant would seem to be counterintuitive. But here's how it works. The drugs stimulate the release of dopamine and norepinephrine, and they slow the rate of their reabsorption, and this allows for more of the neurotransmitter to properly bind to its receptors. This allows the better use of available norepinephrine and dopamine. These drugs can make you feel more alert, focused, and mentally clear, whether you have ADHD or not, Thus Adderall and Ritalin are sometimes consumed off-label and often illegally as smart drugs by college students and those in high-pressure occupations who seek a mental edge. You don't have to rely on drugs to increase norepinephrine and to manage ADHD. John Ridley, MD, clinical professor of psychiatry at Harvard Medical School and best-selling author of Spark, the revolutionary new science of exercise and the brain, has spent decades studying the effects of physical exercise on the brain's function. He found exercise effectively mitigates the ADHD symptoms by raising both norepinephrine and dopamine, thereby regulating the attention system. Norepinephrine is linked to a substantial number of mental health disorders. As with any neurotransmitter, your levels can be either too high or too low. When you've too high a level of norepinephrine, you tend to be anxious and have insomnia. A sudden burst can even trigger a panic attack. Conversely, a norepinephrine deficiency can leave you fatigued and depressed, with little interest in life. People with both fibromyalgia and chronic fatigue often have low norepinephrine levels. Bipolar disorder, which is characterized by excessive mood swings, is linked to an imbalance of norepinephrine. It's suspected high levels cause the manic phase, while low levels cause the depression phase. Debilitating migraine headaches might also be a norepinephrine-related disorder that occurs when the sympathetic nervous system's stores of norepinephrine get depleted. Parkinson's, a motor control disease, is usually associated with the death of neurons in the area of the brain that produces dopamine, but there's evidence that the problem might be related to norepinephrine as well. The loss of norepinephrine can explain some of the non-movement symptoms of the disease, like fatigue and irregular blood pressure. A norepinephrine deficiency might also be a contributing factor in Alzheimer's disease. Normally, the norepinephrine suppresses brain inflammation, which is suspected as an underlying cause of Alzheimer's. But Alzheimer's patients experience minimal anti-inflammatory benefit from norepinephrine, since up to 70% of the cells that produce norepinephrine have been lost. Finding the right drug cocktail can be hit and miss, and these medications often have unwanted side effects. There's ways to help balance the norepinephrine naturally. The amino acid tyrosine is the basic building block of the norepinephrine. You can eat foods that contain tyrosine or phenylalanine, or take amino acid supplements. Virtually all animal products are a good source of both tyrosine and phenylalanine. The foods that increase norepinephrine will be very similar to those that increase dopamine. Some of the foods are bananas, beans, legumes, cheese, chicken, chocolate, eggs, fish and seafood, meat and oatmeal. Norepinephrine is not available in pill form or as a supplement or drug. Medically, intravenous norepinephrine is used to raise dangerously low blood pressure in an emergency, such as when a patient is in shock or having a heart attack. L-tyrosine, a precursor of both norepinephrine and dopamine, is a good natural option to consider if you have a norepinephrine-related depression. It can work surprisingly fast. Human studies repeatedly show that tyrosine excels at countering the effects of extreme physical and psychological stress. Phenylalanine is the master precursor that gets converted into norepinephrine, tyrosine, dopamine, and epinephrine. Phenylalanine supplements are available in the D form or the L form. L-phenylalanine is the natural version, while D-phenylalanine is synthesized in a lab. Some supplements combine both, and this is the DL-phenylalanine. Another amino acid, L-Carnitine, is excellent for brain function, and it's a natural antidepressant. It works by increasing levels of both norepinephrine and serotonin. If you decide to give it a try, make sure to use Alcar or acetyl L-carnitine, a highly bioavailable form of the carnitine that readily enters the brain. Arctic root or Rhodiola rosea is a popular adaptogenic herb that can alleviate depression symptoms as well as antidepressant medication. It works by decreasing cortisol while also increasing levels of norepinephrine, serotonin, and dopamine. The velvet bean, or Mucuna pruens, is a herbal remedy that contains L-dopa, a dopamine precursor. It's useful for treating Parkinson's. One study found it was as effective as typical medications, and it worked faster with fewer side effects. The velvet bean seeds are also a rich source of both norepinephrine and epinephrine. Skip the velvet bean if you have low blood pressure or take hypertension medication, as it can cause the blood pressure to drop. Asian ginseng or Panax ginseng is one of the world's most powerful natural remedies. It's been used in Asia for thousands of years as a tonic, and it's said to bestow long life, strength and wisdom. And now we understand how it works. It reduces the stress hormone cortisol while strengthening the adrenal glands. Compounds unique to ginseng, the ginsenosides, increase both norepinephrine and dopamine concentrations within the brain. While smoking would never be recommended, in order to ingest nicotine, low-dose nicotine patches have been found to alleviate the symptoms of depression, even in non-smokers, by stimulating the release of norepinephrine, serotonin and dopamine. Many college students, biohackers and seniors are already self-medicating with the isolated form of nicotine to improve the mental performance. Nicotine turns out to be a surprisingly safe enhancer of brain function, and it shows promise in treating numerous brain disorders like ADHD, depression, schizophrenia, Parkinson's and Alzheimer's. Before using nicotine in any form for any disorder, talk to a doctor first. Besides food and supplements, there's a few norepinephrine boosting tips. Exercise increases the feel-good brain chemicals. And if you're game, you can enhance the effects of your exercise by finishing up with a cold plunge in water. Jumping into cold water increases norepinephrine levels by 2 to 3 times within minutes. If extreme cold doesn't sound too appealing, you can take a sauna instead. Sitting in a sauna significantly increases norepinephrine up to 3-fold. The overwhelming majority of neurotransmitter imbalances are on the low side, but that's not always the case. If you're among the people with high levels of norepinephrine, it can strongly impact your life. Signs of high norepinephrine levels include racing thoughts, anxiety, and high blood pressure. If your friends have ever referred to you as an adrenaline junkie, a drama queen, or you're prone to addictions, you might have a high norepinephrine level along with elevated dopamine. While there aren't as many natural remedies as there are for increasing the low norepinephrine, there's some interesting options to get lower norepinephrine that use common natural remedies in unexpected ways. 5-HTP is a popular supplement for depression, insomnia and anxiety. It works mainly by boosting serotonin, but it's believed to also deplete some other neurotransmitters, including norepinephrine. You can use this side effect to your advantage if decreasing norepinephrine is your objective. Melatonin is your body's natural sleep hormone and a common sleep supplement. A reliable decrease in norepinephrine occurs after taking melatonin, but oddly, this occurs only if you take it and then lie down. Simply standing up and moving around causes norepinephrine levels to go back up. One of the most unusual tips for reducing norepinephrine is the use of sodium bicarbonate, commonly known as baking soda. Research shows taking baking soda after exercise can reduce the norepinephrine levels by as much as 30%. Norepinephrine is a stress hormone and a neurotransmitter, and it helps the body respond to dangerous and stressful situations. Your level of norepinephrine can be too low, leading to depression and ADHD, or too high, contributing to anxiety. Norepinephrine is closely linked to both epinephrine or adrenaline and dopamine in both function and structure. Common medications like antidepressants and stimulants work by modifying norepinephrine levels, but finding the right drug for a specific situation is a matter of trial and error. Fortunately, there's many natural ways to help to balance the norepinephrine levels with food, supplements, exercise, and lifestyle adjustments. To learn more about neurotransmitters, to book a consultation, or to learn about herbs, supplements, and natural treatments, check out my website.